I would like to provide an update on Operation Airlift that has been taking place out of Israel. The Canadian Armed Forces have been assisting with the departure of Canadian citizens, permanent residents, and their eligible family members from Israel to Athens, Greece. We have used 2 Polaris aircraft that are assigned to this operation, and since October the 12th, the Canadian Armed Forces have been conducting 2 assisted departure flights each day. As of today, there have now been 10 flights carrying approximately 1,200 passengers, and I can confirm that we will continue to provide this assistance for departures as long as will be required. We've been working very closely with the Canadian Foreign Affairs and Global Assistance and the consular services that are in the region to help us with the departure of these individuals. At present, there are 61 CAF members engaged in the operation, including air and ground crews, logistics, and planning officers, as well as medical staff and liaison officers. I would also like to begin as well to talk about some of the things Canada is doing to facilitate departure of Canadians in Gaza and the West Bank. We have been working with partners to explore all options to secure safe passage from Gaza to Egypt through the Rafah border crossing for Canadian citizens, permanent residents, and their families. And as announced earlier today, by Minister Joly, a total of 21 Canadian citizens, in addition to 10 Australians and New Zealanders, have departed by bus from the West Bank and now have safely arrived in Jordan. We will continue to communicate with Canadians on this initiative. We are also actively planning assisted departure options for those who are in the West Bank, including ground travel to Jordan, and we are communicating directly with Canadians in the region who have contacted us seeking support and services. There are currently 20 members of Global Affairs Canada's Standing Rapid Deployment Team who are actively supporting our operations on the ground in Tel Aviv, Ramallah, and Athens to provide emergency consular services to Canadians. I would also like finally to address the humanitarian situation in Gaza. We have been very clear throughout this conflict that we must allow and facilitate rapid and unimpeded humanitarian relief for all Palestinian citizens in Gaza. Canada has and continues to call on all parties to protect all civilians, including Palestinians and Israelis, from harm, and to always respect their obligations under international humanitarian law. We fully support Israel's right to defend itself in accordance with international law, and we will continue to call for the immediate release of all hostages and demand that they be treated in accordance with international law. Canadians in and around the affected areas should regularly consult with Canada's updated travel advice and advisories and sign up with registration of Canadians Abroad Service, and that is the best way to continue to receive information and assistance when required. Thank you very much, and I'll be happy to take your questions.
Minister Blair, can I ask about Operation Neon? What's your response to a Chinese jet intercepting a Canadian aircraft off the coast of China?
Yeah, of course. Under Operation Neon, Canada is participating in the UN mission to oversee the sanctions that are currently being imposed upon North Korea. We have been serving in Operation Neon for multiple missions over the past number of years. Unfortunately, during these missions, it's become a rather routine matter that aircraft of the People's Republic of China military services regularly interact with those oversight flights. We're there doing the job that the UN requires of us. And under normal circumstances, the vast majority of those interactions with the People's Republic of China military are professional and although routine, have been fairly safe. The interaction, unfortunately, that took place very recently is one that was not professional and not safe. And the actions of the Chinese military in these circumstances, I think, was unacceptable and put our aircraft and their mission at significant risk. There are appropriate ways for us to deal with this, as has happened in the past. There are diplomatic processes that we engage in order to register our concern about the actions of the People's Republic of China military plane in this instance, and those processes are well underway today.
And as you say, this has become more routine, but this is one of the most aggressive provocations yet. So how concerned are you?
There have been other instances of unprofessional conduct, and so when that happens, of course it's concerned. The safety of the men and women who serve in the Canadian Armed Forces, the importance of the mission that they're on through UPNEON is critically important, and it's part of our international obligations. I am very concerned that of the unprofessional way in which this was done. It was, quite frankly, dangerous and reckless. And those type of behaviors are not ever acceptable, and we will express that to the People's Republic of China in the most appropriate way. Okay, thank you all very much.
I wanted to know, like, it's been noticed that Amiral Gawali has not made any public statements about the situation with Hamas and Israel, contrary to Erwin Kotler, who wrote an open piece in newspapers. So what do you think about that?
I think that's a question that I'm sure you can ask her office directly, but I fully trust her in her role as a special representative in combating Islamophobia. Her role, her mandate is domestic, and I know she's been working extremely hard in our community and in the country to work with community members to fight Islamophobia. I also know, as you may know today, we made an announcement today, earlier today, on our new special envoy on combating anti-Semitism, and I know Ms. Deborah Lyons, who is a fantastic, incredible individual who's going to work extremely closely with Amira, and I know the two of them actually have been in touch on seeing how they can continue to work together to fight discrimination, hatred in our country as we speak.
Do you expect her to make a public statement?
I am sure, if you ask her office, I'm sure she'll get back.
But as a minister, do you expect her to?
I truly respect her for the work that she's doing. Her mandate is domestic in fighting Islamophobia. She's doing tremendous work in our communities as we speak, and we're going to continue to make sure she does that work alongside Deborah Lyons, our new special representative, special envoy on combating anti-Semitism, to do that exactly.
Trigger Islamophobia here in Canada, right?
Absolutely, and that's exactly and that is exactly the type of work that she's doing as we speak. Thank you.
What have you heard from constituents over the weekend up till now about what we're seeing in Israel and what we're hearing in Gaza as well?
The Canadian Jewish community is absolutely shattered. People don't know what to think. They're sad, they're horrified, they're angry. Everybody knows somebody that's been deeply affected. You know, the Canadian Jewish community has been here since 1760, but the homeland of Israel for the Jewish people, the only majority Jewish state in the world, touches everyone, whether you have relatives or friends there or you just feel a connection. And I've never seen our community feel more insecure in Canada in my lifetime.
Are you satisfied with the response police or even political leaders have in terms of increased threats or even some of the rhetoric we're seeing from demonstrations? What do you make of this?
Well, I've been very satisfied. The Jewish caucus and I worked with Minister LeBlanc to make sure the RCMP reached out to provincial and municipal police forces across the country, and they've done a stellar job. I want to thank all those police forces and Minister LeBlanc. I've been incredibly impressed, and I think the communities, at least in Montreal and Toronto and Ottawa, feel much, much safer. I haven't spoken to communities across the country, but I believe policing has been similar in other centers across the country. But that doesn't mean that lots of parents are not wondering whether to send their kids to school, particularly last Friday. That doesn't mean that people are not worried that people are taking, you know, I have people that are even worried that people are taking pictures of their houses and videos of their houses with mezuzah. It's like, there are people that are taking it to a level that I've never seen before.
Monsieur Housefather, qu'est-ce que vous pensez du siège complet imposé par Israël à Gaza en ce moment? Est-ce que c'est justifié, d'après vous, dans les circonstances? Parce qu'il y a des gens qui disent que le gouvernement canadien devrait dénoncer ça de manière plus ferme. Qu'est-ce que vous en pensez?
Il n'y a aucune démocratie dans le monde qui a eu une attaque terroriste d'un groupe terroriste qui veut faire disparaître ce pays, où le monde aura dit « tu ne peux pas répondre à ça ». Oui, c'est certain, il faut éviter le mort des civils le plus possible. Et oui, il devrait y avoir un corridor pour les gens de passer. Mais Israël a le droit de se répondre dans le droit international et Israël a le droit de se répondre.
Y compris avec un siège complet, parce qu'il y a des gens sur le terrain qui disent en ce moment que c'est quand même aussi une catastrophe humanitaire, ce qui se passe là, plus d'eau, plus de médicaments, des choses comme ça. Alors pour vous quand même, dans ces circonstances-là, le siège complet est justifié?
Encore, qu'est-ce que je dis? Il devrait y avoir un corridor. C'est l'Égypte qui peut permettre ce corridor. On devrait aider les gens le plus possible. C'est Hamas, le groupe terroriste, qui dit à les gens qu'ils ne peuvent pas quitter la ville de Gaza. Et je crois qu'Israël a une histoire de respecter les droits des civils le plus possible et ils vont continuer de le faire.
Et vous l'avez vécu comment depuis samedi, personnellement, puis par rapport à...
Ma communauté est le plus déchirée que j'ai jamais vue de ma vie. Les Juifs sont à Montréal depuis 1760 et j'ai jamais vécu une expérience où la communauté juive se sentait tellement insécure, tellement peur de leur sauveté. Les gens ne savaient même pas s'ils devraient envoyer leurs enfants à l'école vendredi passé. La police de Montréal était fantastique, les polices tout à travers le pays étaient fantastiques, mais il y a un grand peur, une inquiétude qui est là face aux manifestations qui ont eu lieu au Canada.
Should Canada be doing anything more to get people out of the region? We're hearing about air flights. The corridor fell through over the weekend. Can Canada be doing any more? Should it be?
I mean, I think Canada has been doing everything it can. We had pushed very hard to have flights to evacuate Canadians. There have been 2 a day that have been leaving from Israel. There are still other flights on El Al and other airlines that are going. And I encourage Canadians who are there who wish to leave to get out as fast as possible. And External Affairs or Global Affairs will be reaching out to everybody who is registered who wants to go for a flight as long as we possibly can take people out. And I think, again, Canada has to do everything we can in this situation to help make sure that Canadians who are there, whether in Israel or in Gaza, can leave.
Est-ce que vous seriez attendu à ce qu'Amiral Gawabi fasse une déclaration publique?
J'ai jamais. C'est pas à moi de dire aux autres s'ils devraient faire des déclarations ou non.
Pour calmer le jeu après les manifestations qui ont eu lieu au Canada après l'attaque, est-ce qu'il n'y avait pas lieu de
je ne veux pas mettre. Oui, tout à fait, mais je ne veux pas mettre ça sur une personne. Je crois que tout le monde devrait condamner les manifestations au Canada qui ont appuyé le meurtre des Israéliens et des Canadiens. De 6 Canadiens sont morts aussi. Donc, tout le monde devrait dénoncer.
La famille de certains otages, possiblement canadiens?
J'ai parlé, depuis le début, j'ai parlé avec la famille Luc qui a perdu leur enfant. J'ai parlé avec une famille, les Georgie, qui malheureusement, on a vu qu'elle est morte. Je parle quotidiennement avec la famille de les Lapidotes qui est un otage en Israël. Et je fais mon possible pour essayer d'assurer les familles qu'on va faire n'importe qu'est-ce qu'on peut faire.
Given the humanitarian situation in Gaza, is it Canada's place? Should Canada be asking Israel for any kind of restraint?
I think at this point, you have a Western democracy that was attacked by a terrorist group that had the worst killing of Jews in any day since the Holocaust. No other country in that situation where the terrorist group is bent on destroying that entire country and Jewish communities around the world would not respond. Israel needs to respond. Israel has a right to defend its borders, to defend itself and defend its people. Certainly we want to avoid humanitarian losses. Canada wants to make sure civilians are protected as much as possible, and I count on Israel to do that. Thanks very much, guys.
Merci.
Bonne journée.
Bonjour. What do you think of the signal that was sent by the militants this weekend regarding the agreement with the Liberals?
Well, we call them militants, I call them Canadians.
The members.
The members.
Okay.
Yeah, got it. Well, I think it was a crystal clear message to the government that we want public pharmacare, and we expect the Liberals to deliver on the promise, and it's going to be a red line for us.
So it is truly a red line. You guys are down to pull from the deal if it's not universal single payer.
It's 100% condition.
Why is it such a red line?
Because 8 million Canadians right now, as we're talking, don't have access to pharmaceutical coverage. Millions more have some, but it's deficient. Thousands of people die every year to G7 countries because they don't get access to medication. And yet we know there's a public policy recommended by royal commissions, advisory councils, committees going back to the 40s, telling us there's a solution. And that's to fold pharmaceuticals into our single-payer system. Eric Hoskins advised it, the Health Committee, Standing Committee on Health advised it, the Romanow Commission advised it. So it's an excellent public policy solution to a pressing problem. And it's time Liberals delivered.
Would there be a price to pay politically to pull the plug on the agreement eventually?
You know, sometimes you have to stand on principle. And this is a principle worth fighting for. You know, it was the NDP that forced the Liberals to bring in healthcare in the 60s. And we're going to force them to bring in pharmacare in the 2000s, or expose them for frankly, the faux progressives that they are. You know, in 1997, the Liberals promised public pharmacare to Canadians at election. 3 times Liberal delegates to conventions, 2016, 2018, 2021. Liberal delegates voted in favor of public pharmacare. So Liberals have to decide, are they going to stand with their own members and Canadians, or are they going to stand with the profits of insurance companies and big pharma?
Minister Holland,
Coming? Is it at the budget in March? When do you think this test will come?
Well, you know, the confidence and supply agreement calls for legislation to be passed by the end of this year. So I think the test is right now, and it's in the next 2 months.
Minister Holland was just out here talking about the talks are focused on the art of the possible. He's talking about fiscal constraints. Is the vision that you guys have what you want, universal single-payer system, is it realistically or legitimately on the table right now?
You know, pharmacare saves money. I don't know how many times the Liberals have to be convinced of that. The PBO just last week, in the first year alone, would save $1 billion. The incremental savings occur immediately, and they occur over time. The incremental costs to set up are $10 billion, but then the savings start coming in from bulk buying, from streamlined administration, and the PBO confirmed that time and time again. And drug costs are out of control in this country. We spend the third highest prices in the world, so we need to bring in pharmacare not only to help Canadians' health, but also rein in costs.
How are the talks
It's a
going?
smart economic
How are the
policy.
talks
How
on
are
that
people
going?
supposed to believe, though, that the NDP has made this agreement with the government, and clearly the finances of the party have had challenges over a number of years? Do you think the Liberals are going to believe that the NDP is in a position to pull the plug at this time?
Well, I don't know how clear a message we could send than a unanimous resolution passed this weekend, and NDP health critic going to the mic saying, I support pulling out of the confidence agreement if Liberals don't deliver on their promise to bring in public pharmacare.
Just to be clear,
so I think the Liberals ignore that at their peril.
Just to be clear,
How can they take it seriously when it's written in the resolution that it is non-binding?
Well, it's only non-binding because everything at convention is
I know
non-binding.
that, but it's even specified.
Well, I'm the NDP health critic, and I went to the mic. I was the only speaker to it, and I endorsed it. And our leader has endorsed it as well.
Because you didn't have a choice?
No, of course we have a choice. It's because we believe it's the right thing to do.
so just to be 100% crystal clear, you're speaking for the party, the parliamentary caucus right now. The NDP is willing to pull out of the deal if it's not the pharmacare deal you want. Not the
Absolutely.
Pharmacare Act you want.
Absolutely.
How do you measure their intent right now, the Liberals? Do you feel that they're more interested in looking at maybe budget cuts more than this agreement? What feel do you get from them? It seems that you are a bit worried.
It's very confusing. I mean, they themselves tell the public they believe in public pharmacare. They campaign on it. They pass resolutions at convention. They appoint their own advisory committee. Eric Hoskins wasn't a health committee. It was the Trudeau Advisory Council who advised them. Are they not going to take the advice of the person they appointed? So to try to get inside their heads, I don't know. All I can tell you is this government seems to be lobbied very extensively by the pharmaceutical industry and by the insurance industry. And of course, if we're going to save billions, which we will by pharmacare, that's $1 coming out of the pockets of insurance and pharmacare or pharmaceutical companies. And so, to me, they have a decision to make. Do they want to stand with the profits of those industries, or do they want to stand for the health of Canadians?
Are you guys
That's
ready
what
to fight an
Liberals have
election
to
on that
make.
issue? Are you ready to fight an election?
Absolutely.
Mr. Davies, what's the timeline? Like, by this date or else? Like, what's red line by when?
Well, that wasn't covered by the resolution. I mean, the confidence and supply agreement says we have to have legislation passed this year. I mean, I haven't received a signal from the Liberal government that they're going to commit to public pharmacare. Were they to do that, I'd rather get the system right. But, I think we're heading to the crunch time. We have 2 months left in this legislative session, so that's not a lot of time to pass legislation.
Would introducing legislation be enough for the NDP?
Well, it's passing legislation, right? Not introducing. Well, that's what the CASA calls for. It calls right now for us to pass legislation on pharmacare, and then it calls for establishing a formulary and a bulk buying program by the end of the agreement, which is June 2025. So we're at the first stage of that obligation right now, and I'm trying to make sure the Liberals pass the proper legislation, which is single-payer pharmacare, and nothing less than that will satisfy us.
Is there any time to do that?
There's enough time, but time is short.
How are the talks going with that?
It's possible, but it's
holidays?
it's very short. I agree, but it's very possible. I mean, we'd probably have to use time allocation to get it done in the House, and then it has to go over to the Senate. So you're absolutely right. It's a challenge, but that's one of the reasons why we've been working very cooperatively with Liberals. We've told them, look, get the structure right. We can be patient on implementation. That's why we said start with essential medications. right? That's about $3.5 billion a year, 55% of prescriptions. Start there. And let's work on that, and then we can build incrementally over time. So we have compromised. We have done everything that we can do, but now the ball's in Liberals' court, and we'll see if they keep their promise.
How are those talks going? How would you characterize the discussions that are going on right now with the Liberals on this?
Well, they've been very polite, and they've been very convivial, and I have a very good relationship with Minister Holland. So it's not a personal thing, it's a matter of policy. For some reason, this Liberal government does not want to commit to single-payer pharmacare. And it's up to them to explain to Canadians why not, especially when on clinical, ethical, and economic grounds, it's a no-brainer.
So everything else in the deal, I know it's not all health stuff, right? There's a bunch of other stuff in there. Is this the hill that you guys are willing to die on, to put it crudely? That if the other stuff didn't happen, this is worth it?
Well, I'm the health critic, so the most important things in the deal are health-related. And, of course, we have dental care, which I must say we've made excellent progress on. And I think you're going to see a very good dental program start to be implemented this December. So I'm very happy with the progress on dental care. And, I don't want anything to jeopardize that. But pharmacare is equally important. I mean, again, you want to live in a G7 country where, 8 million Canadians can't get the medicine their doctors prescribe? I don't. And so they're going to have to do something about it. And we're calling the Liberals on their bluff. They can't continue to tell Canadians they believe in universal pharmacare, but then balk whenever they have to actually do anything. And I'll say one more thing. We're in a minority parliament. If they don't do it now, when they have the NDP support and Trudeau put his signature on a document, then when will they do it?
But can I just ask, given, I mean this with all due respect, because I'm not insinuating that Canadians don't care about access to medication or the cost of medication, but there is also a global context that is, frankly, taking up it's taking center stage in the House. There's going to be a debate tonight on it. Is this the appropriate time for the NDP to essentially be threatening to rip cord on a working agreement with the government, given the fact that there is a global crisis that many Canadians are affected by and impacted by?
Well, I think Canadians would agree that there can be many profound issues that a government has to deal with at the same time, and it's not meant to put one over another. And I agree there are very serious issues going on, but I don't think there's many issues more important than people's health. I'll repeat, thousands of people die every year simply because they don't get access to medication. The nurses did a study on that. Just 3 diseases they looked at was responsible for hundreds of preventable deaths every year. So I don't know, do you want to be your grandmother or your sister or your cousin? I don't want it to be anybody I know. I don't want it to be any Canadian. So it's important.
Is the party's caucus going to be putting a timeline on this, past this by a certain date or we're out?
Well, I'm working right now as hard as I can in the next 2 months to get the legislation. I haven't given up. I'm still working constructively with Minister Holland. They haven't said no. They haven't said yes. So I'm going to continue to push them as hard as I can to do what they said they're going to do and to do what they know is the right policy. So that's my focus right now. My focus is on pulling out of the deal. My focus is on getting public pharmacare established properly. And that's what I'm going to continue to do in the next 2 months.
Thank you.
Thank you so much.
So what do you think of the resolution, NDP resolution, that they're willing to get rid of the deal if you don't create a public pharmacare that's complete and single?
Well, look, we had a great week last week with the launch of the BC bilateral agreement. I had a great opportunity for 2 days at the health ministers meeting to talk to them about priorities across the health system. It's essential that we stay focused on the health transformation that needs to occur, and that absolutely includes making sure that drugs are affordable for Canadians.
Are you willing to go for a single payer?
Well, what I think there's an ongoing discussion that's happening, not only with the NDP as our partner in the Supply and Confidence Agreement with all parliamentarians, about what should be included in pharmacare legislation. And those discussions are ongoing. They'll be informed by the art of the possible and taking a look at what's in the best interests of our health system and what's in the best interests of the fiscal reality that we're in today. So we're going to make the decision that's right for Canadians, and that's going to mean an ongoing process of negotiation and discussions. And of course, people will have very firm opinions of what they think those outcomes should be, as they should. But the negotiations are ongoing.
But I'm hearing there's not enough money for a single single-payer system?
Well, I think that there is, the way that I talk about it, when you go past a new building that's being constructed, it can look like the foundation's taking forever to be made. But once the foundation's in place, that sets up the conditions to build the rest of the building. What we're talking about now is the foundation of our action on pharmacare and pharmaceuticals in Canada. It's important that we get that right. It is absolutely true that we're in a challenging fiscal environment where we have to be prudent and be aware of the fiscal reality that we're in, and that's the basis under which we're negotiating.
Okay, and so I'm hearing provinces are reluctant because they have mixed systems and they don't really want a single-payer system.
Well, the conversation I had with health ministers in Charlottetown for over those 2 days, they expressed that there's a lot of work to be done, this is an extremely complex landscape. We have different pharmacare systems that exist in every province and territory, and within those province and territories, a myriad of private plans as well. So getting to a decision on how we're going to navigate that space is going to be challenging, which is why we have to be prudent in those discussions and make sure that we take it step by step and get it right.
Are you willing to compromise?
I'm always willing to compromise, but that compromise has to be in the best interest of the public health system, and it has to be realistic against the fiscal climate that we're in.
Sorry, you probably already asked this, but the NDP's motion out of their convention to essentially draw a red line on this and say it has to be universal single payer or else we're out of the deal. What do you make of that? What do you think? Have you heard anything from officially the parliamentary team?
It doesn't change anything from my perspective. I think Canadians want to make sure the decisions that we make are prudent, that are the right decisions for our health system, and are the right system for our fiscal climate. And so, before the NDP... Oh, sorry about that. WASP had a different feeling on things. Before the NDP convention, there were a lot of disparate and heartfelt, passionate positions on pharmacare. After the convention, that remains the same. And so we have to operate from a place of logic and the needs of the whole system, and obviously the fiscal constraints that we find ourselves in. And so that's the way in which we'll continue these negotiations and discussions, not only with the NDP, but with all parliamentarians.
Are you guys willing to go that far, though, to a single-payer universal system? Is that on the table at all? Or are you guys going somewhere closer to, not that far, I guess?
That's part of the conversation. Part of the conversation is what exactly can we achieve now in the form of legislation for pharmacare. I think it's really important to acknowledge that we've already made huge progress in a number of areas that are really important, like bulk purchasing that we've engaged in with provinces and territories and stakeholders has seen almost $3.5 billion in drug savings, and that's an annual figure. And then there are what we're doing in rare diseases, drugs for rare diseases, as well as the action that we've taken on patented drugs. So, there's a lot of opportunities here. I think that what we should be interested in right now is the transformation of our healthcare system. So one of the things I was saying before you came is the agreement that we struck in BC about putting health indicators, showing exactly how the money that we put, the $200 billion, is going to work and be operationalized in provinces to improve health outcomes is essential. And the conversations that I had on workforce issues, on data, and on health transformation with health ministers in Charlottetown, I think was really important. So our health system is big, its challenges are large, but so are the opportunities, and we have to move through those prudently. And I appreciate people have passionate feelings in all different areas of health, but it's our job to make sure that we're doing the right thing in the right order.
So Quebec is never going to want an agreement like the one you signed in BC with
well, it's very simple for It's very simple for Quebec. It has nothing to do with jurisdiction. It has to do with clear indicators so that Canadians, regardless of where they live, can see how the federal investment that is being made is resulting in a change in health outcomes. So that isn't about jurisdiction. That's about making sure that everybody, everywhere, can see how the investments in federal health are going to make a meaningful difference in terms of health outcomes. And we have to be able to show that in data. I mean, when I talk to kids...
So it would be a blank check without any...
No, that's not an option.
Is what the NDP wants an option, though? If I understand, it sounds like it is, but is that what the NDP wants: single-payer, universal pharmacare system. Is
well,
that
one
on
of the things.
table?
Look, one of the things that I know, and I understand that it's frustrating. That when we're having a conversation on something as important as pharmacare, there's a desire to be right on the inside of that negotiation and be aware of all the machinations back and forth. But I in my experience, because I dealt with a lot of negotiations of very sensitive subjects as House Leader, that those movements right and left, up and down, it would be imprudent and unhelpful to the process that we're having to have that all laid out. I think there are hard conversations, not only that are being had with the New Democrats as the Supply and Confidence partners, but with all parliamentarians, with stakeholders, about what is the art of possible here, and that's complicated, and I've been very open throughout that to try to understand what is the most responsible action to take. And we're not far off from being in a position to be able to declare ourselves and talk about what that outcome is. I'm hopeful that it's one that we can work on collaboratively with the NDP. I have reason to believe that we'll be able to talk and work together. But whatever the outcome is, I want to make sure that when I come to the microphone, that negotiation process has been exhausted, that the opportunity to understand the context that we're in and what the solutions are available, and I can give you clear and cogent answers on the way forward.
Avez-vous affaire au NPD, ce qu'il demande? Et avez-vous peur qu'il déchire l'entente?
Est-ce que j'ai peur quoi?
Avez-vous peur qu'il déchire l'entente avec les libéraux, avec votre parti?
C'est pour moi, c'est pas une question. C'est tellement important, à mon avis, de s'assurer que, premièrement, notre focus est qu'est-ce que c'est le bonne chose de faire, qu'est-ce que c'est la bonne action de prendre. Et après ça, c'est une question de les partisaneries et la politique et la communication. Mais c'est pour moi, c'est vraiment une question, qu'est-ce que c'est la meilleure chose qu'on peut faire d'améliorer notre système de santé et la chose qui est aussi prudente dans une situation où les situations fiscales est difficile aussi.
Is it even, given that fiscal situation, we saw the PBO report, quite, I think, starting at $11 billion a year with some savings, maybe $9 billion a year going up. Given this fiscal situation, is it even possible or responsible to go all the way and do what the NDP is wanting, to go to this universal system?
I think there are fair questions about what is possible in the fiscal framework that we're in, and I think Canadians expect us to be prudent with the fiscal framework. Canada enjoys one of the most enviable positions in the world in terms of our fiscal situation. We have the lowest debt to GDP of any G7 country. We have the lowest deficit, and we have a AAA credit rating, and that puts us in a very strong position that we need to maintain. We have one of the lowest rates of inflation among OECD countries. We need to make sure that continues. We need to continue to be a leader. And look, it doesn't feel great to lead when the whole world is down, but it's sure going to feel good when the world is up, and we have to make sure that we remain leaders in that area. So that's an important backdrop. It's not lost on me.
We're already in October. Is it still possible to have that legislation at least introduced in the House of Commons before
That's my
the
objective.
December?
That's my objective. That's my
You'll
objective.
say it
But it's
hasn't
not going to
passed,
be
though, right?
adopted.
Well, look, I think that the spirit of the Supply and Confidence Agreement would be that we would find a way forward on pharmacare legislation. It didn't specify those details about what that would look like. That's what we're into right now. In my mind, the spirit of that agreement is that we would have legislation introduced this session, and that's my intention, to see us introduce legislation before the session's up. Thanks, everybody.
Thanks.